Causes of infertility.
Infertility is the inability to conceive after 1 year of regular, unprotected intercourse. It affects both men and women, and the causes can be classified into male, female, and unexplained factors. Below are some of the common causes of infertility in both men and women. Module 4, Unit 1. Causes of female infertility. Causes of female infertility. Female infertility refers to a woman's inability to conceive after 1 year of regular unprotected intercourse. It can be due to a variety of issues affecting the reproductive system. Causes of female infertility can be classified into ovulatory disorders, structural problems, hormonal imbalances, and other health conditions. First, ovulatory disorders. Ovulation is the process where a mature egg is released from the ovary. When this process is disrupted, it can lead to infertility. Key causes include polycystic ovary syndrome, PCOS, a hormonal imbalance that affects ovulation. Women with PCOS often have high levels of androgens, male hormones, and insulin resistance, which can result in irregular or absent ovulation, making it harder to conceive. Symptoms: irregular menstrual cycles, excessive hair growth, acne, and infertility. Hypothalamic dysfunction. The hypothalamus in the brain controls the release of gonadotropin-releasing hormone, GnRH, which stimulates the pituitary gland to release LH, luteinizing hormone, and FSH, follicle-stimulating hormone. If the hypothalamus isn't functioning correctly due to stress, excessive exercise, low body fat, or eating disorders, ovulation may not occur. Conditions like hypothalamic amenorrhea can result from this dysfunction, leading to infertility. Premature ovarian insufficiency, POI, also called premature menopause. POI occurs when the ovaries stop working before the age of 40, leading to a decrease in egg quantity and quality. This can cause irregular periods or complete cessation of menstruation. Common causes include autoimmune diseases, genetic disorders, and chemotherapy. Hyperprolactinemia, elevated levels of prolactin, a hormone that stimulates milk production, can suppress ovulation by interfering with the normal production of estrogen and progesterone, leading to irregular cycles or anovulation, lack of ovulation. Common causes include pituitary tumors, prolactinomas, medications, or thyroid disorders. Second, fallopian tube blockage or damage. The fallopian tubes are essential for transporting the egg from the ovary to the uterus. Blockages or damage can prevent fertilization or implantation. Pelvic inflammatory disease, PID. PID is often caused by sexually transmitted infections, STIs, such as chlamydia or gonorrhea. It can lead to scarring, inflammation, and adhesions in the fallopian tubes, causing blockages that interfere with egg movement and fertilization. Symptoms: pain during intercourse, abnormal vaginal discharge, fever or pelvic pain. Endometriosis, a condition where the tissue that normally lines the uterus grows outside it, often on the ovaries or fallopian tubes. This can lead to scarring, adhesions, and inflammation that block the fallopian tubes and distort pelvic anatomy, making it difficult for an egg to be fertilized. Symptoms: painful periods, heavy menstrual bleeding, and pelvic pain. Previous surgeries: abdominal or pelvic surgeries, such as appendectomies, cesarean sections, or fibroid removals, can cause scarring or adhesions that may block the fallopian tubes. Third, uterine or cervical issues. The uterus is where a fertilized egg implants and grows. Conditions that affect the uterus or cervix can make it difficult to conceive or maintain a pregnancy. Uterine fibroids. Non-cancerous growths in the wall of the uterus can interfere with implantation or obstruct the fallopian tubes. Large fibroids can distort the uterine cavity, making it difficult for the embryo to implant properly. Symptoms: heavy or painful periods, pelvic pressure or back pain. Cervical stenosis, narrowing of the cervix, often due to scarring from infections or surgeries, can block the passage of sperm into the uterus, making conception difficult. Some women may also have cervical mucus that is hostile to sperm, making it difficult for sperm to travel through the cervix to the uterus. Uterine abnormalities. Congenital. Some women are born with uterine abnormalities like a septate uterus, a partition in the uterus, or bicornuate uterus, a uterus with two cavities, which can affect implantation and lead to miscarriage. Acquired conditions like endometrial polyps or adhesions after surgery can also affect implantation. Fourth, age-related factors. Decreased egg quality and quantity. As a woman ages, the quantity and quality of her eggs decrease, especially after the age of 35. This can lead to difficulty getting pregnant and an increased risk of chromosomal abnormalities like Down syndrome. Older women may also experience a higher risk of miscarriage and other complications during pregnancy. 5. Hormonal imbalances. Hormonal disruptions can affect ovulation and reproductive health. Thyroid disorders, hypothyroidism, hyperthyroidism. An underactive or overactive thyroid can affect hormone production and menstrual cycles, interfering with ovulation and fertility. Symptoms: weight gain, fatigue, hypothyroidism, or weight loss and anxiety, hyperthyroidism, prolactin imbalance. Elevated prolactin can suppress ovulation and is often seen in women with pituitary tumors. It can disrupt the regular production of estrogen and progesterone. 6. Lifestyle factors. Certain lifestyle choices and habits can affect a woman's fertility. Smoking. Smoking accelerates the loss of eggs and decreases egg quality, leading to infertility. It can also cause damage to the fallopian tubes and increase the risk of miscarriage and ectopic pregnancy. Obesity and underweight. Being overweight or underweight can lead to hormonal imbalances, disrupt ovulation, and decrease fertility. Obesity, in particular, is linked to conditions like PCOS, excessive alcohol or drug use. Chronic alcohol consumption or drug use, especially marijuana, cocaine, and heroin, can interfere with ovulation, impair egg quality, and reduce fertility. 7th, autoimmune disorders. Autoimmune diseases occur when the immune system attacks the body's own tissues. Some autoimmune conditions can affect fertility by impairing reproductive function, lupus or rheumatoid arthritis. These conditions can cause inflammation and damage to the ovaries, fallopian tubes, or uterus, making it harder to conceive. Medications used to treat these conditions may also interfere with fertility.